All right, so I tried to figure out how to make the financial portion of the healthcare.gov or finding a health plan. You can use my healthsherpa.com link below to really kind of figure out where the costs and everything lie and how much I gotta spend out of pocket to make these more expensive plans worth it. So I made a spreadsheet. In the spreadsheet, it's just financial. So you'll see a big disclaimer in the front, all these notes and the methods that I went through. So the method and the kind of thought process is that before you put things into the spreadsheet, you have to first decide, or you have to first find apples to apples. So if you want a HMO plan by Blue Cross Blue Shield, this will allow you to plug in one plan versus the other plan. The bronze HMO from Blue Cross Blue Shield to the gold HMO from Blue Cross Blue Shield. Or if you want an AM Better PPO, you get an AM Better PPO bronze and you compare it to the AM Better PPO gold or platinum or silver. That's what this sheet's made for. So before you do that, you need to figure out which of these plans are going to make the most sense. If you have a doctor, you put the doctor in and you make sure the doctor's in the network. If you have prescription medications, you take a look at the formulary and make sure that the medications that you take are on the company's formulary. Right? That's still in the quantitative side. The fun part is if you have doctor visits or specialists, or you have certain ongoing treatments or infusions. If you're somebody who uses or feels like you use a lot of medical care and you pay a lot in medical bills, you should just default to the bronze plan, because the bronze plan is going to save you the most money because you're going to hit the max out of pocket one way or the other. You might as well pay the least amount per month to hit that max out of pocket. You can still use the spreadsheet, to figure out if you're going to be saving money on the financial risk portion by using the maximum financial risk button or maximum total risk advantage, and that's going to show you how much you are actually saving versus the plan that you put on the top. So let's go in and see what the different plans or what the algorithm actually or spreadsheet looks like. So the spreadsheet's going to tell you what the plans are going to be on the top: platinum plan, what the annualized premium is, what the annual deductible is, the annual max out of pocket is, and the metal level of cost share. So for a platinum plan, it's 90%. Now, the plan below is going to be the lowest cost plan. So typically it's going to be your high deductible bronze plan, where the deductible and the max out of pocket are the same number. This is probably going to be the cheapest plan if you organize by lowest premium at the top. From there, you need to put in the annual premium and the annual deductible. From that point on, the formula within the next box on row 11, out-of-pocket cost to break even. So the amount that shows up here is the amount that you have to pay in the bronze plan in medical expenses and out-of-pocket medical expenses to match the amount that you would have paid in the corresponding plan on the top. So for example, in this example here, I would have to have paid $8,903 out of my own pocket in addition to premiums per month. And at that point, the platinum plan would have been the same. We would have broken even. The bronze plan no longer has any financial value to me because I have reached the break-even point. From this point on, the platinum plan will save me the most money until I hit the maximum out of pocket. Because on the bronze plan, on top of the out-of-pocket break-even, I still have the premium savings, which is kind of helping me a little bit. So outside of that, the total financial or the total risk advantage is the difference between the max out of pocket and the premium spent. Now, some plans have a lower maximum out of pocket. Some plans might have a maximum out of pocket of $15,000 or $14,000. And that'll kind of close that gap on what our portion is. We can say that in a lot of these plans, we got like a huge deductible, but we do have a manageable maximum out of pocket because the maximum out of pocket protects us from these huge financial responsibilities. So that's how you use the spreadsheet. Again, the spreadsheet is not going to be your end all be all because some of these visits aren't 90-10 on the platinum plan. Some of these visits aren't 60-40 on a bronze plan. Some of the plans offer you free generic medications. Maybe 2 times you can go to the primary care doctor for free. All these plans have different little bells and whistles that make it better. Some plans will reward you. If you go for your annual physical, you go to the gym a few times, they might give you $50 or $60 to use toward paying for some of these things, like the deductible. So it really does depend on all those little bells, frills, and whistles that are in the plan, but you won't know what's really out there until you look. But this way, with this, you'll be able to see financially and within seconds of you plugging in the number where your break even is. That's the amount that you'd have to pay out of pocket to make it worth enrolling in the more expensive plan. And then from that point on, what the total risk advantage is on joining a bronze plan versus the more expensive silver, gold, or platinum plan. And that total risk advantage, again, is the difference between the max out of pocket for both plans and the premium you spent. Because if you were to max out your max out of pocket, the platinum plan, gold plan, or silver plan is going to cost more, because at that point you have no more medical bills when you hit the max out of pocket. So buying better cost share doesn't help you in any way. If you want to learn more about this worksheet or how I think about saving money on healthcare, do leave a comment. Let me know so I can make more videos like this. If not, I hope to see you in the next video, where we'll talk more about ACA and my personal experience on this interesting program.